Screencast is going to be the introduction to medicine and drugs. At the end of this screencast, you should be able to list the effects of medicine and drugs on the functioning of the body, describe the different methods of administering drugs, discuss the terms therapeutic window, tolerance, and side effects, and outline the stages involved in the research, development, and testing of new pharmaceutical products. Throughout the screencast, I'm going to try to highlight that information that you need to know and information that you need to be familiar with. This is chapter 15 in your book. All right, let's go. Your body has a defense system, and there are 3 lines of defense. The first line of defense is your skin, protecting your insides, your mucous membranes. Then there's a second line of defense, and that would be your white blood cells that fight infection, blood clotting so that you don't bleed to death if you get a cut, and then an inflammatory response which speeds blood cells to a site of an injury, thereby providing oxygen and to heal that section. And then there's a third line of defense, antibodies and memory cells. All right, so what is a drug versus a medicine? A drug is just a chemical substance that affects how the body works. For example, falling under this class would be heroin. A medicine is a substance that improves health. There's some kind of therapeutic effect. In other words, that there is a beneficial effect of the medicine. You should be familiar with that term, therapeutic effect. If we were to look at a quick Venn diagram, if we have a big category called drugs, within that big category there is a subcategory, and this is where medicines would fall. Okay, so medicines are considered drugs, but they have to have a beneficial effect, which makes them medicine. All right, so what are effects of medicine and drugs? Well, there is an alteration of the physiological state, and that includes your consciousness, your activity level, and your coordination. Okay? Physiology is the study of the function in the body. So some of these effects are going to be alteration of incoming sensory sensations and the alteration sometimes of moods or emotions. Okay? This study of the functioning of the body includes things like liver, kidney function, and other internal organs. Okay, let's focus for a moment on methods of drug delivery. How do these drugs get into our bodies? And the factor, okay, to determine what is the best method for drug delivery, that is, how to get them into our bodies, we have to think about the nature of the drug, and specifically whether the drug is going to last. Whether the drug is going to last as it goes through our GI tract, if it's not going to survive the gastric juices, the acid in our stomach, then that's probably not the best way. This nature of the drug is you're going to be looking at the chemistry actually of the drug. Okay, the physical characteristics. Okay. And what is it compatible with? Is it best as a pill? Is it best as a shot? That's short, it should say shot. Okay. Okay. Also to keep in consideration is the condition of the patient. If the person is in a coma, a pill-based form probably is not good. Okay? If the patient is an infant, Typically infants can't swallow pills, so they would not be a good candidate for drug delivery in the pill form. And then also to consider is the most effective way to deliver the drug to the target organ. Okay, so factors: nature of the drug, condition of the patient, most effective way to deliver that drug to the target organ. How can we get drugs into our system? Well, we can take them orally. It's taken by the mouth. That can be a liquid, it can be a pill. If we choose this, then the delivery is going to be through the GI tract to the target organ. Oh, geez. Inhalation, this is vapor or smoke breathed in. You see this a lot with asthma patients with their treatments. And obviously, this would target the lungs. There are skin patches. These are patches that you stick on the skin, and the drug is absorbed through the skin. I should say the medicine is absorbed through the skin. This is more of a time-released situation, and this helps keep the dose consistent throughout that time frame. There are suppositories. Those are inserted into the rectum. Sometimes if nausea is severe, things can't be taken orally through the mouth. So you've got to find a different way. There are eye and ear drops, and then there's the injection route. There are actually 3 different types of injections. Those 3 different types are intramuscular. Those are injected right into the muscle. Things like vaccines are delivered this way. There are intravenous. Those are injected straight into the bloodstream, into the vein. This is the fastest drug delivery method. Things like anesthetics are delivered that way. You want a quick response time. You put it into the bloodstream, and it circulates through the body that way. Then there are subcutaneous method, and that's injected directly under the surface of the skin. These 3 types you need to know. You need to know the term, you need to know the definition. There's also another term that I found that you should be familiar with, and that is parent. And this is when medicine is taken by means other than the digestive tract. It should be AN, than the digestive tract. The subcutaneous dental injections, that's that Novocaine that you get at the dentist. Okay, or a local anesthetic for like stitches. Okay. So, the type of drugs that we're going to be studying in this unit. There are basically 3 types. First type are those that target the brain and the nervous system. These would be analgesics, stimulants, and depressants. Then there will be the second type, those that target the metabolic processes. Those would be antacids. And then The third type will be those that supplement the body's ability to fight disease. Those would be antibacterials and antiviral. So that's the overview of what we'll be doing in this unit. Part of why this unit would, I think, be considered fairly important are, remember that the body is very complex. Okay, the body's systems are all interrelated. So we've got to look at both the intended effects, and we're also going to be looking at unintended effects on the body or other systems. And those intended effects are on target organs. Okay, and then the unintended effects might be any other system in the body. Okay, so let's define a couple of terms real quick. For all types of medicines, we are trying to balance the therapeutic effects versus something called side effects. Therapeutic effect is the intended physiological effect. Side effects are unintended physiological effects. Some of these may be positive effects. Things like aspirin, reducing the risk of heart attack and stroke. So that says aspirin reducing the risk of heart attack and stroke. And then there are minor negative side effects. Things like nausea. Nausea and dizziness are termed minor. And then the major side effects, some examples would be stroke or heart attack. Okay, so important terms to note: definitions, therapeutic effect, the intended physiological effect, and side effects, unintended physiological effects. Okay, so let's talk about something called a therapeutic window. This is important. We're going to need to know the definitions and how this is used in application. Therapeutic window is defined as the range of concentrations of a medicine where it can be safely and effectively administered. And there is a window because if the concentration is too low, it's not going to have any noticeable therapeutic effect. And then if the concentration is too high, your side effects become too harmful and you kind of outdo any therapeutic effects that you had had with that drug. So what is this therapeutic window? Well, the therapeutic window can be quantified using the ratio of something called LD50 and ED50. LD50 stands for lethal dose at 50%, and what that means is that it is the dose that is required to kill 50% of a tested population over a defined period of time. So this is kind of your toxicity level. And that, of course, would be your upper limit of the drug. And then ED50 is the effective dose, the dose at which provides a therapeutic effect for 50% of the population tested. Okay, and this will kind of be your minimum dosage. Okay. And scientists use this ratio of the two to determine the therapeutic window. Okay. So, a small therapeutic window means that there is a very narrow difference between the effective dose and the lethal dose. And with that small therapeutic window, you've got to be high enough so that you're giving the therapeutic effect, but you've got to be very careful that it's not too high, because then you've got a significant threat of an overdose. A larger therapeutic window is what you would hope for, and that indicates that your effective dose is fairly small and your lethal dose is comparatively large. There is a big difference between the two. All right, so here with a large therapeutic window, you have a minor risk of an overdose. Okay, and there's more of a range between that lethal and effective. Important concepts to note and understand. Okay, so what kind of factors impact the therapeutic window? Well, the age and sex of the patient. Age and sex of the patient. Okay, and this is very adult versus pediatric. Okay, the weight of the patient, the diet of the patient, the environment that that patient is in, what other drugs or medicines the patient is on, and the dosing regime. Ideally, what you would like to have is the concentration of the drug over time to be flat. You would like to have a consistent dosage. In reality, when you take medicine, particularly pill form, you have some peaks and valleys over time. Okay, so the flat line, consistent concentration over time, is what would be desired. Oh, geez. Desired. Okay, and in reality, depending on the format, this is like more likely of a scenario. Okay. And all of these things have to be considered when you talk about the therapeutic window. Okay, so you've got risks associated with a small therapeutic window, and you have to decide what is tolerable. All right, for minor ailments, okay, a wide therapeutic window is desirable. You have less chance of an overdose, and this is going to be something like, a headache. Okay, and these would typically be because there is a smaller risk with a wide therapeutic window. Over-the-counter medications would typically fall under things that have a wide therapeutic window. For major ailment, okay, and we're talking things like cancer, you may be willing to have a more narrow therapeutic window because what you're treating is fairly serious and often can cause severe health effects, just the ailment, right? And these things would be like chemotherapy, particularly. They're getting better. In the early days of chemotherapy, it sometimes came close to killing you to get rid of those cancer cells, and that was a narrow therapeutic window. A lot of oversight by doctor visits. You're going to be in the hospital so that they can keep a close eye on the side effects of that medicine. Okay. So let's talk about tolerance. Okay, you can build up a tolerance to a drug over time. And tolerance can be defined as, and you should know the definition, it's a reduced response to a drug after multiple exposures. And the idea is that over time you build up a tolerance to a drug, so more drug is given to achieve the same effect. Okay, and as a result, there's a greater likelihood for a drug overdose. You come closer and closer to that lethal dose. And this is particularly of concern with things like cocaine, heroin, and alcohol. Okay. There's your lethal dose and your effective dose, and over time your effective dose, you kind of creep up and you get close, or can get close, to that lethal dose. So these are your doses as your tolerance is building up, so that you get that same high or that same effect from that drug. Okay, so kind of gave an overview